At this New Hampshire home, all in for Andrew Yang, we met up with the tech entrepreneur.
Let me just show you this.
We showed him what these Democratic voters told us over and over. They're worried about health care.
The expenses we've taken on as a family because we have to have health insurance now, like it's too expensive. Our deductible is still $10,000. And it's absurd.
I work 3 jobs. I work more than 40 hours a week, and I still don't have any insurance.
Their stories are 100% normal, and that does not have to be this way in America. We're spending twice as much on our healthcare as other countries to worse results. And it's because we have a system that's designed not to maximize our health and well-being. It's a system designed to maximize revenue on the part of private insurers, device companies, drug manufacturers, and this healthcare industrial complex that is profiting from us. If you're an employer, which I have been, our current system makes it harder to hire someone, harder to give them benefits. 94% of the new jobs getting created in the United States right now are temp, gig, or contract jobs that don't have healthcare benefits. And no one would design a system that would link healthcare to employment in a time when 94% of new jobs are temp jobs. And we're automating away more and more jobs as we speak. So I'm for a Medicare for All system that would expand access and get costs down. And the trap that Democrats are in right now, everyone's like, how do you pay for it? How do you pay for it? If you look at how much we're currently spending on our health care, there's plenty of money in the system. It's just not going to making us stronger and healthier. It's going to the device companies, the drug companies, and the private insurers. If we do it right, Americans will be very excited about how they experience health care. And my plan would not get rid of all private insurers. But the problem right now is that private insurers, again, just ratchet up the costs every single year because they don't have any real competition on the basis of cost. That mom feels like, well, I don't have a choice. That's just what it costs.
This has been an evolution for you, though, because if I understand correctly, you're for Medicare for All now. Where were you 6 months ago?
I've been for Medicare for All the whole time. Because I've worked in the healthcare industry and I know how messed up the incentives are. I know how crazy the pricing and the costs are. And I know there's no way to get those under control except for the government to insert itself between these insurers and the American people.
I'm going to go back to you because you've run businesses, started businesses. Was the current healthcare system prohibitive to you in terms of this is the thing I want to do, but I'm not sure how I can incorporate healthcare into this, cost-wise or burden? What burden was it?
It was a massive burden. And I ran a business in the education industry, and we had to make a choice whether our teachers were full-time employees and thus would get healthcare benefits or contractors. And I'm sure that 90% of companies in our shoes would have said they're contractors because they're showing up, they're teaching, and they're going home. But we looked at it and said, well, this doesn't seem to be doing right by them. And so we switched everyone almost immediately, if they wanted to be a full-time employee, and then provided health care. But that was a massive cost to us. I said to a friend at the time, it's like banging my head against the wall, being like, why am I having to become an expert in healthcare and health insurance when it has nothing to do with my business? And it was certainly a disincentive to hire more people. I mean, we did well and we grew and grew, but we would have hired more people if we weren't having to stack on the cost of health insurance for every additional worker.
Does this feel like this is a moral choice, or is this just good business sense from your perspective to change the way healthcare is delivered in the United States?
It is immoral that our infant mortality rates and our health outcomes are toward the bottom of the developed world along many, many measures. That is immoral. That means people are suffering and even dying unnecessarily. But this is also an economic driver, where right now Americans around the country know this, that we're not starting businesses, changing jobs, hiring people, making decisions based upon what we want to do. We're making these decisions in part based upon this massive healthcare bureaucracy that's weighing us down. And if you get that bureaucracy off of our backs, you would actually see an amazing amount of growth, expansion, hiring, and even new business formation.
if these changes are going to be made, what will the bill be to the American taxpayer?
Well, that's the joy of it, Harry, is that right now if you start at a point where we're spending 18% of GDP, which we are, almost $4 trillion, to worse results than other countries, you can almost not help but save money if you rationalize these costs. And the people that are going to be left out in the cold are the drug companies, the device companies, and the private insurers, who are really just sucking value. They're like a hidden tax on the American people.
You win the election, you have been campaigning on this really significant change in the healthcare system, but then you get to the general election, and then you have other people to persuade. Or do you have to move back to the center?
I think Americans right now are fed up with the fact that our healthcare industrial complex is the #1 cause of personal bankruptcy. And if you get sick or injured, you're more stressed out about paying for it or navigating our crazy system than actually focusing on getting well. It does not need to be this way. And certainly there are a lot of scare tactics around healthcare. But if we can let Americans know that we can do much, much better than this, I believe it will be a very compelling general election issue.
Money in our hands. Put the money in our hands. Put the money in our hands. Can we afford it? Yes. Will it cause inflation? No. Is it awesome? Yes. Is anyone trying to make it happen? Yeah, that guy.